Hello dear students, today I am going to talk on speech therapy, which is a therapeutic intervention which is used broadly in the field of special education, to deal with the communication and some language disorders. So in this we are going to focus only basic of speech therapy, which I am going to talk about definition, objectives, scope and intervention part. So let us go and understand what is definition of speech therapy. So speech therapy is the assessment and treatment. Yes, speech, we are not talking about speech therapist, okay? Speech therapy, that means what does that mean? What is that modalities? So that we are going to understand. So speech therapy is the assessment and intervention of communication problem. This speech therapy is used to improve the communication skills among the children. Okay, it might be intellectual disability as well as the what you say normal child, and those who have a speech disorder. So it is performed by the speech pathologist, which is called SLP, and there are different courses which you can see in different what you say colleges, okay, which directly they will indulge and they will teach about different modalities and intervention about a speech therapy. So see, this is often referred as a speech therapist, as I said. So that is very important. Okay, speech therapy is a part of special education. If speech therapy is delayed, that means the half of the child's development will be stopped. So that's why the speech therapy is very important in special education. Now let us see the objectives of speech therapy. As I said, improving coordination of speech muscle through strengthening and coordinating exercises, maybe a sound repetition or imitation. Okay, so they will try to intervene the child with the help of repetition and imitation. Anyways, we will look in the intervention what kind of things they will do. So this is an objective of speech therapy. Then improving a communication between the brain and the body through the visual and auditory aid, such as a mirror and tape recorder. They will keep a mirror in the front of the child, and they will try to imitate, or they will try to show how the sound looks, how the shape of the mouth looks, how you modulate, or what kind of sound, with the help of tape recorder. They will make the child to listen that, and they will ask the child to repeat. Improve the fluency through the breathing exercises. That is also one objective where they will try. If the child has a communication problem, what you can do if the child has a communication problem, if the child is able to blow the air, so you can keep a piece of paper in the front of mouth and just ask the child to blow. If the child is able to achieve that task, that means the child is able to breathe properly and able to go further. Enhancing the learning of language through a language stimulation and the use of language through positive reinforcement. See, as we have in our intervention and strategies how to deal with intellectual disability in the classroom, even they have a positive reinforcement. Even they follow the concept of reinforcement when they have to deal with this kind of improvement. Improving the communication by helping a child learn alternate way to communicate. Okay, see, the communication is not only in the classroom, the communication is not only in the self-contained area. Okay, so they will teach in the different modalities, like for example gesturing in the environment, and then signing, augmentative communication device. They can use the communication pouch, they can use the technology. See, communication here is not only with the sound, rather non-verbal. So non-verbal is also a communication. Communication is whether the child is able to express his need to the opposite person or not. Okay, so that you need to remember. The main goal of speech therapy is to improve the communication, not to bring the sound. That is, something else. So to improve the communication, whatever the child has, whether you are taking to the next level or not, that is very very important. So that speech therapist will do. Okay, so explain the important stages of the first word and the intention in the meaning. So that is also they do in that way. So there are different objectives they will try to focus. So this is the main important objectives which you can think over. Then let us see the scope. Okay, they have a broad scope in the different area, like community health centers. Yes, even they have a scope. They can go to the community health centers and they can work there, they can train there. There are hospitals, you can see a lot of hospitals with the speech therapy, with the speech modalities, with the speech machines, where they try to indulge into that. So hospital also they can go and try to give the services. Then you have a public health unit. Yes, even the public health units you can see in the mandals, or somewhere in the rural areas. You can just go there and you can find a speech therapy to help the children with all the disabilities, those who have a speech problem. And then you have a private practices, that is like it is like a clinic. You know better what is a clinic. They just go there and they will give the session and they will try to improve the communication part of the child. And then you have a patient or a client home. Even you visit a home and then you take the sessions. And then corporate and manufacturing setting. Yes, speech and audiologist, they will try to manufacture the things, what is a audiometry machines, all these things they will try to do. So they have a broader scope in the developing in the developing communication of the child. And even in the governmental ministries, they have a role to play to to work on the policies and to work on the conditions of the machines. And then you have university and colleges. Yes, even they have opportunities to teach to the other graduates. And then you have a school where they can work as a speech therapy, where they can work as a speech therapy to deal with the problem. And the final one is your nursing home and the child care facilities. So there also you can see the speech therapies. So a big S is very very important in speech therapy. Now let us see modalities and intervention one by one. So teaching comprehension skills. See, this strategy is well tried, okay, and can be effective if they judged initially by acquisition of correct responding to the situation. For example, when the child has come to the center, or when the speech therapy is teaching, make sure that how the child is acquiring the your responses, the situation. Okay, so situation can be a peculiar of for many reasons. Okay, so it doesn't mean that on that particular situation he has to respond, but that's what I'm talking about. Situation is entirely controlled by the teacher, speech therapist or instructor, okay, who decide what should be talked about and what the responses shall be. So that is controlled by the speech therapist, the instructor, the teacher. Further, as I said, even they follow the positive reinforcement. So further they will be rewarded, the child will be rewarded with the reinforcers, arbitrary in relation. That means as per the condition you can select the reinforcement as per the content. That means the random choice. Okay, rewards are very random in relation to the content whatever you are teaching. So in other words, we are dealing with a very artificial teaching strategy when we compare it to normal acquisition of language. Normal acquisition of language, you see the normal boy, they will be where they feel very easy to acquire those. Whereas when we teach the children with intellectual disability, when they have, we need to go with the artificial teaching strategies. That means condition, you need to create an artificial condition so that child can achieve your target. Okay, so that means teaching comprehension skills, you will be comprehending to the student. That is a one way or one strategy to acquire the a speech. Then second one is teaching instruction followings, like rather than just teaching the person to point out or child to point out a specific objects, okay, students are taught to follow the instructions such as come here, sit down, stand up, go there, and then they will be rewarded. This is also like arbitrary, that means random selection of the reinforcer based on the situation, and again this is controlled by the teacher. That means teaching instruction is very important. What do you mean by sit down? What do you mean by come here? So in that way, what happened, the child will try to learn, the instructions, okay, because this strategy has some value while dealing with individual, okay, who has a complete lack of social interaction. And this is very very important. That's what I said in the beginning. It's a teamwork, it's a correct assessment, then only you can treat. So the child, for example, don't have a social interaction, you can start with the teaching instruction, because that is also a part of speech therapist, okay, a speech therapy modalities. So this can also be used while teaching following to construct the noun, the verb. That is little higher way when the child achieve these small instructions. And then you have a imitation training, that means I do, you do. That means this strategy is generally used effectively in the initial teaching of expressive speech or signing. For example, when the child is non-verbal, you try to sign, and even the same way the child even tries to imitate that. Or sometime what happen, you will say ah, even child will try to say ah, okay. So modeling is used by the teacher with the student, okay, and even physically prompted initially, and then practice, then the child may learn to imitate response. This is how the speech therapy will use this modality. This is very simple, I do, you do, that's it. And this imitation training again is typically controlled by the teacher. That means all the strategies is controlled by the instructor, okay. So this is very very important. And this also, the rewards are arbitrary, that means it depends upon the random selection of the reinforcers. So child, for example, child may be asked to imitate the word like tea and given a pat on the back of the reward. So what you will do, when the child said tea, you will be giving a pat. That means patting the child on the back, very good. So that is your reinforcer, okay. So teaching situation is highly artificial, that means it is conditioned. You have created the situation to deal, or to take your intervention strategy to the next level. So this is very very simple. It can be very easy to understand. Now let us see the fourth modalities and intervention, that is teaching expressing skills. See, expressing skill is what, how I'm going to convey my message to the other. That is your expressive skills, okay. So the most frequent used procedure for teaching expressive skill is to show the student an object, picture events, and say, look here, what's this, okay, or what is the what's the man doing in that picture, can you tell me what's happening in that picture. So this is how the child can able to express the skills. So if the child is responding correctly, you will give the reward. If it is incorrect, you will prompt again, you have to do it again, and then again you will reward, and then chain will go on, okay. So once again the procedure can be effective in the it represents a situation which is highly artificial, controlled by the teacher. So make sure that even whenever you teach the child, the three things you need to remember. It should be artificial. You need to create the artificial teachings to understand the concept, control the students. That means it will be controlled, whole strategies will be controlled, and the reinforcement must be arbitrary. That means random selection, on even on the spot you can select. So that all you need to control. So this is how you can just pause the video and just try to understand, read if I'm a little fast, so that you can understand slowly. And then let us see some suggested modifications for speech instructions, like satisfying the child's communication need. See, this involves identifying what the child requires to communicate and rearranging the environment so as to make the child ask for the same. So that is, see, we create a need to communicate in the communication context. Okay, so satisfy the child's communication need first, and then learning to say no or indicating no. See, the child requires to refuse, okay, either by using a gesture or using by word. For this to happen, the environment has to be rearranged. Okay, adult gives the wrong choice after the child's requests. So what you have to do, you need to you need to teach the child to say no indications, which is very, very important. So normally we say no, so you need to do some modifications in that. And the third one is your violation of routine events. So here, routine events such as getting water, going for a food, are intentionally violated to evoke the protest or focus the child attention to particular language aspects. Okay, so that you can think over when you teach the child. Then withholding a object hand turns. So this helps the children in initiating the language to gain attention requested on objects or make a comments. Okay, so that is also very, very important modification which you can do while teaching the communication skills. Violation of objects function or objects manipulation. See, when the children are familiar with the action routine, such as as opening a pen, writing, putting on dress, the so that the children need to initiate the directives and make a protest. Okay, so that they can understand the function of the object, so that they can manipulate the object. So you can involve the child in understanding the concept in that way, either pushing it directly. Then you have a hiding object. See, this strategy is particularly useful in facilitating development of question forms and early forms of what do you say, negations, like child finds that an object is not present and ask where it is. So that's very, very important. You can hide the object and you can ask where it is. So in that way you can make it. Then tea party technique. Here the tea party technique is not sitting with the tea with the friends and enjoying the tea. See, in this technique it's not like that. In this technique, language is taught in a meaningful setting, such as the tea party, dinner situation. You need to, again I am telling you, teacher need to control artificial techniques. Okay, normally how we talk when a tea party, we just talk a lot of things, but when it comes for the children with intellectual disability, those who have a problem, so what you can do here is you can just create a situation. Okay, here the child first acquires a knowledge in a simple meaningful situation, for example tea party. Okay, so the idea is that the children learn how a tea party runs in the term of use of cups, then plates, the knife, the tea, the milk, the sugar. So in that way you can associate the action like stirring, cutting, pouring. So these all can be controlled, can be planned in a natural situation. So that can play a major role in such modifications. Okay, and then have a language story technique. Here the language story technique means fun and excitements to most children, especially if the children with intellectual disability or those who like story. So in that way you can use this story, especially constructed around the theme, which is again controlled by the teacher, with the familiarity, what's happening in the picture, and you can give a challenge. See, this technique emphasizes the improvement of language through teaching grammatical rules. So it can be used to teach controlled set of syllable, vocabularies, concepts. So in that way you can use this storytelling. See, the storytelling should help the child to grasp semantic content initially, symbols, and then emphasis should be to shift the higher aspects. Okay, so that is very, very important. And then let the language and communication disorder. See, here we are going to understand the two aspects: what problem are cured and how to cure. So what problem are cured, that means what are the problem and how it is cured. So what are the problem the child will have? Stammering problem. In stammering problem, the child will be having a repetitive things, and stop, that means child will stop and then will start. Okay, and stuck, some children will be stuck in between while explaining, or he will be blank, there will be no word. So that kind of stammering you may have. Okay, so what you will be like stop, just now I have stopped. So in that way they will be having. Okay, then reading and writing problem. The child may have reading and writing problem, so even they can be cured. Difficulty in creating a sentence. Okay, then voice quality will be not good of the child, so that also can be cured. Fluency, that means there is a problem in the child's fluency. Child is not able to talk properly in a proper manner. Then sometimes slow and sometimes fast, so that pitch can be also improved. Then attention and memory, always he forget what he's supposed to say, so that is also there. So these are few problems where a speech therapy will encounter while addressing the while assessing the child. So let us see how to cure this, how it can be cured, what are the steps. Identify your problem. Okay, observation, which is very, very important. Then pronunciation, consonant and vowels, specific letters. What is a consonant, what is a vowels? So that you need to first identify the problem via observation. Then pronunciation, how the child's pronunciation is, whether the child has consonant good or vowels. Okay, and then tongue exercise is very, very, ask the child to rotate the tongue, ask the child to remove the tongue out, then go take it inside, roll, something like that. Okay, so that the tongue get exercises. Then visual structure, chart, diagram, picture, flashcard, that can be used to teach the child. Communication practice, 1 hour or 2 hours, or any stories that can help. Give the picture and ask the child to talk at least 1 hour, at least half an hour, something or the other. So this is how you can cure those kind of things. Specific tips and tricks, end of the session you have to give, when you end the session as a speech therapy, you must give some tips and tricks to the parents so that they can apply it, because at the end you want your child to learn better. So in that way you need to give the specific tricks, and that specific tricks must be based on your session. Okay, the child must try to search